folks, this is Brad, senior broker with Mad as a Hatter Insurance. We've already talked about short-term medical quite a bit in our introductory video to Mad as a Hatter Insurance. So I'm going to keep this brief, just going over a real brief brochure that United Healthcare puts out. So short-term health insurance frequently asked questions. How do I know if short-term health insurance is a good choice for me? If you're between jobs, waiting for other coverage to begin, waiting to be eligible for Medicare coverage, without health insurance outside of open enrollment and it's just a few months away. For these situations and more, when you're stuck in a coverage gap, finding the best short-term health insurance plan might just be the right solution for you. In my opinion, bar none, the best plan out there is United Healthcare. They're the biggest health insurance carrier in the country. They know what they're doing, and they don't take advantage of their customers. The short-term health insurance provide coverage for pre-existing conditions? No, it does not. In most cases, short-term insurance plans never cover pre-existing conditions. I haven't seen one yet, which, depending on your state's definition, would mean something you received diagnosis or treatment for within the last 2 to 5 years, potentially even the last 12 months to 5 years. If you're in this situation, you may want to explore other options or see if you can extend your current insurance plan. Actually, to be honest with you, we do work with a company. It's called HII, their Cardinal Choice Plan, which is a guaranteed issue plan. But still, pre-existing conditions aren't covered for the first 12 months to help guard their risk. So at this point, there's not really anything that's why we work mostly with people that are in great shape physically and health condition, because there's not really anything out there that covers pre-existing conditions for the first 12 months. So if you've lost your insurance, if you've lost your job, if you've moved to another state, depending on the state and how the exchange works, those are what's called health change events, life change events, which if you write a letter and send it to the organization that controls CMS, which controls Obamacare, Medicaid, Medicare, there's a good chance you can get on Obamacare, but we know about Obamacare and how the premiums keep going up and the deductibles keep going up, etc. But if that's all you can get because you have pre-existing conditions, it's better than nothing, and you got to take care of yourself. So is preventive care covered under short-term health insurance? Preventive care can sometimes be covered under a short-term plan, but may be limited. Check plan details for more information. Contact the health carrier. Will prescriptions be covered if I get temporary health insurance? Prescriptions may be covered on some plans. Check specific plan details to learn more. And we have 2 really great RX programs that save people a ton of money and cover a lot of drugs on their formulary. Is my current doctor covered under this plan? It is possible, but check the network offered by any short-term health insurance you plan to buy for the inclusion of doctors that are important to you. Do I need to select a primary care provider? While some plans may require you to select a PCP as your main point of contact for your healthcare management, temporary health insurance plans often give you the flexibility to see any qualified healthcare provider you choose. Do I need a referral from my PCP? Referrals are not required to see a specialist with short-term medical plans, at least not through Golden Rule Insurance Company, which is the managing entity owned by United Healthcare for the the individual market. Do short-term plans meet federal requirements of the Affordable Care Act? No, thank God they don't, or they'd be a lot more expensive. Can I get a tax subsidy to help pay for my short-term health insurance? No, thank God they don't. You can't, because you'd, again, be paying more money. Is short-term medical insurance limited to annual enrollment periods? No, short-term insurance plans have no such restrictions and are available year-round. However, very important caveat here. What used to be a 12-month cycle on short-term plans, thanks to Obama's legacy, or as we like to call him, Obama, he took out the 12-month period for short-term plans because his idea was to force everybody in the nation to go on to Obamacare. So now it's 90 days. Every 90 days, your policy renews, and therefore, every 90 days, your deduction, your deductible renews. We went over that quite a bit at length in our introductory video, so I'll save you that here. Are there multiple plan choices and price ranges available? Most often, the answer is yes. For example, short-term medical underwritten by Golden Rule Insurance Companies offers multiple plans, deductible choices to meet a range of budgets and needs. Do short-term health insurance plans have high deductibles? Well, it kind of depends on what you mean as a high deductible. To many people, $1,000. It's a pretty high deductible, but that's the starting range of most short-term medical plans. What if I don't need my temporary insurance coverage for as long as I'd planned? Short-term health insurance plans can be canceled at any time without penalty. Any premium paid beyond the new termination date will be returned to you. Caveat, that's with United Healthcare. I don't know about other carriers. Can I renew this type of health insurance coverage? No, short-term coverage is limited to the duration selected. Therefore, it's non-renewable, which is why the deduction goes up or back, recycles again. The deductible recycles every time you have to start it up again. If I'm looking for the best short-term health insurance price, do I have options to help me reduce my premium payments? Yes, choosing a plan with fewer benefits or a higher deductible or single upfront payment options are all effective ways. Can I pair other plans with temporary insurance? Yes, short-term is often combined with other supplemental like gap policies to help round out the coverage. So, again, we're going to leave it at that for short-term. You can always go on United Healthcare or email us if you need more information on short-term. It's mostly going to be for students or for people in between jobs or for people that have to wait 90 days for insurance to kick in and they just want something short-term. Again, thank you very much. Today is July 14th, 2018. If you have any questions, feel free to give us a call, email us, or go online to our website and go to our contact form, and we'll get back to you as soon as possible. Thanks, and have a great day.